Hello, my name is Dr. David Anik. I'm a psychiatrist with Partners Healthcare. This is a two-part presentation for primary care physicians and nurse practitioners who will encounter adults with attention deficit disorder, ADD, or attention deficit hyperactivity disorder, ADHD, in primary care practices. Part 1 describes how adult ADD or ADHD shows up in primary care and how to make the diagnosis. Part 2 will go into management of the condition using stimulant medication. We begin with a role-play interview in which I'm the primary care physician and my colleague Anjanette plays an adult patient who is wondering if she might have ADD.
Well, I was talking with a coworker who told me he has ADHD. And when I asked him what that was like, it sounded like he was describing me. So I had to wonder if I have it too. Like, I get distracted a lot, I lose my keys all the time, and I really have trouble focusing. And the worst is in the afternoons. Without coffee, I would never get anything done.
Wow. Well, sure. Let me ask you about some common challenges in ADD or ADHD. When you say you get distracted, can you give me an example of how that shows up in your life?
I hardly ever read books. Maybe I can manage a newspaper article. If I'm tired, I have to read a paragraph 2 or 3 times before I can grasp it. It can take me a while to finish a few pages.
Wow, that must be frustrating. How about in a conversation? Are you someone who is prone to interrupting others? Or in a meeting or classroom, might you blurt out your thoughts or call out the answer when it's not your turn?
I used to do that. As a kid, I would get sent out into the hallway for talking too much. I think since around high school, I've learned to hold back.
Do you ever find yourself starting several projects but finishing few?
How'd you know? My sewing is like that. I have 4 projects that I'm currently working on. I bounce back and forth. And if it wasn't for Christmas and wanting to give them out as presents, I don't think I would finish.
So how do you feel about deadlines like Christmas? If I assigned you a report that was due in 30 days, what would happen over the next 30 days?
I might look at it now, and a week before, I think I would think about it a little bit more, and then the night before, I would stay up all night long.
And okay. So it sounds like deadlines cause you stress, but they are also your friends, since without them you might never finish anything. Tell me about time management in general. Like, do you tend to be late for things or misjudge how long a task will take?
That was a real problem, but now I have apps and alarms that I use to remind me of all kinds of things. And that has made a huge difference for me getting to places on time.
Many people with ADD talk about difficulty focusing, and you mentioned that. How is it when you have to stop what you are doing and turn your attention to something new?
Yeah, I use a lot of time trying to get myself to start new things. I always say I have trouble focusing. It's weird. Sometimes I get hyper-focused for hours at a time if it's something that interests me.
So if you have to, say, pay your bills or do your laundry, it's hard to make yourself focus on doing that, what you need to do, rather than what you're interested in doing.
Yeah, that's pretty much it.
Do you tend to have trouble sitting still, like in a meeting when you would be expected to stay in your seat?
Not so much. My coworker with ADHD is a lot like that. Though he feels like he's a motor. You should see him. Some part of his body is always in motion.
One more question. Let's say you find yourself in a long line at the bank, or maybe you're stuck in traffic. Of course, no one likes it, but do you find it sort of unbearable? Like, how is that situation for you?
Sometimes I've taken a different route that takes longer, just to get out of the stop-and-go traffic. The bank queue is not so bad because I can always entertain myself using my smartphone.
Well, it does sound like you have a lot of traits in common with people who have ADD. Not so much the hyperactivity part in your case. And it also sounds like you have learned over the years how to compensate for some of your natural ADD tendencies, like interruptions, lateness, or boredom. that speaks well for you, that you have learned how to adapt and function better. I'm going to ask you to fill out this form just to document which of the types of challenges that we have talked about apply to you. This is called the Adult ADHD Self-Report Scale, or ASRS. Based on the conversation we have just had in this form, we will come up with a plan to help you manage your condition.
Thank you so much, Dr.